Today's video we are going over self-treatment for degenerative disc disease. My name is Dawn, this is Sebastian. We work at Performance Place Sports Care, and we are the locally world famous chiropractors in Costa Mesa.
Locally world famous.
Woohoo! And so what we're going to do is just show you what you can do at home for degenerative disc disease. We do have other videos that you can check out that tells you what it is, what causes it, things of that sort. But today we're just getting right into maybe 2 things that you can do from home to help settle symptoms from degenerative disc.
Yeah, and we're specifically talking about lumbar disc degenerative disease. At some point we're going to make some videos with cervical degenerative disc disease, but the interventions, the stretches, the home treatments are a little bit different. But we're going to spend a little bit of time on the lower half today.
Cool.
Okay. Would you like to be the model or the doctor first?
I'll be doctor first.
Okay,
All
great.
right. So he's going to lay on his back here. He's going to take his time getting there. Perfect. We're going to bring our feet up. And we're just going to use my knee here. I'm cutting my head off, but I think that's going to be okay. So we're going to use my knee here. But at home, you can use a bed, a chair, a stool, whatever you got to just put yourself in kind of a 90-degree position here, and we're going to breathe. Okay, so where his hands are is actually where we're going to focus the breath. You may not have noticed that maybe you're a chest breather, and learning to breathe into your belly can actually be really supportive and distractive for the spine.
I was told I should hollow when I breathe.
We're definitely not hollowing today for this specifically. So where your hands are, I want you to take 2 breaths. Try to push your hands to the ceiling with your breath.
So push like...
Kind of, but leave your back flat to the ground. Just let breathing into the belly, let your hands go to the ceiling. I'm going to give you a couple of rounds to do that. While we're here and while he's figuring out how to breathe into his belly, you might have something pop up on the screen. It's a webinar learning more about degenerative disc disease, low back issues. Take advantage of that. It's a free resource for you to learn more about what's going on with you. How do you feel like you're doing, Seb?
I mean, I feel like, should this be really complicated?
It shouldn't be, but some people get it really easily, and some people it takes a little bit longer to find it.
If I was having problems finding it, what's one way I could do it?
Problems finding it, you could bring your knees a little closer. So just dragging here. So we're not quite at 90 anymore, but now we're in a little more hip flexion. Having a flatter back to the ground and a little shorter abdominal wall here, you might be able to breathe into it easier.
Yeah, I feel like I'm able to it's almost like it's pressing me up.
Mm-hmm. Absolutely.
With each breath.
Yep, that, and also too, you can put a little bit of weight with your heels, back your ankles into me. That's going to lift you up a little bit more. Mm-hmm. And that, you may notice that it activates abdominal wall. Maybe you can breathe into that a little bit better.
Yeah.
Perfect. So those are 2 things if you're having a hard time finding the belly. Try and see which one of those helps you. And let's see if then you can expand wide now. So you're going to go hands wrapped around you like so. And you're going to see if with your breath you can push your hands out wide like so.
So I'm wondering then with, everybody might wonder, like, why is this our first pick?
Yeah, it seems really silly, right? Like, how is this going to stop my degenerative disc disease? Basically, we could get into details of what it is, but when you have degenerative disc disease, you lose disc height, which means certain structures are getting compressed on a little bit more, which is usually where your symptoms are coming from. When we learn to breathe into the abdominal wall properly like this, it actually creates a natural distraction of the spine, and it's really supportive of the spine as well. So it can be giving you symptom relief, as well as if you can take this into your movements throughout the day, it might protect what's going on there.
So I don't need to be on one of those machines that rips me in half?
Nope.
Okay.
If that's something that you would like to do because you don't want to do work, that's totally fine. But learning active ways to do this on your own at home actually is going to give you a bit longer benefit or more benefit because you could do it wherever you are.
Okay.
Okay. So I'd spend however long you need to try to breathe into this. And once you get the feeling of, yep, I'm doing it, I'm expanding properly, spend maybe a minute, 2 minutes doing this, get up, retest, see how you feel.
Okay.
Awesome.
All right. We're switching roles now. Go and lie on your back again. So the second thing that you could do is you can advance that same strategy that Dawn was just talking about. And so with her, we're going to act like she's already mastered this whole thing. All right. By the way, when you're down here, how many times does your dog just attack you?
Often.
Yeah. So when you guys are paying attention to learning how to do this, you may want to just get your animal out of the room, don't let anyone talk to you, because it is a little bit cumbersome sometimes. Next thing we're going to do is we're going to use the breathing strategy, but also implement something called a brace. A brace can be helpful with stiffening the abdominal wall and the core, which can help out with lower back pain and advancements of disc degenerative disease. Hold that position for me. Is that painful at all?
No.
Now, some people, when they're doing this, they may start to experience some pain when they start to lose position, as Dawn is right now. She's just losing position. And it's not necessarily that her legs are going the wrong way, it's that her lower back is starting to arch off the floor. And so some people, what you could do is if you had a blood pressure cuff, not everyone needs one, but if you put a blood pressure cuff under your back and then look at the gauge, if you lose pressure, that means you're lifting up.
That's pretty good.
So it's a nice, easy feedback tool.
Heck yeah.
And so go ahead and hold that position again. All right. And I can see her shake a little bit, so this is a little bit hard for her. That's just what we want. And so ideally, go ahead and relax, is Dawn mentioned that the compressive aspect of degenerative disc disease is what creates the symptoms, and you start to flatten into things like the lumbar facets and sometimes the nerve roots. And so a lot of times people like that have an issue with lumbar extension. It's more painful to extend their lumbar spine. And so this is an anti-extension strategy where her lower back is trying to extend because her legs are going to weight her down, but her abdominal brace is not allowing it. And so we're teaching her how to use her abdominal air without having to really do sit-ups. Good. Go and take a break.
Whew.
Good stuff, right?
Yeah. I mean, you feel kind of the lower abdomen, almost like the whole abdomen working here. So when you're in that position, you take your breathing exercise you focused on and to put it into this one and you combine the two, you'll see some benefit here.
Yeah. I think even doing that, like you mentioned, breathing just for a couple minutes a day is really helpful. It can help with things like with the sciatica associated with degenerative disc disease, facet irritation, even some of the hip tightness you might be experiencing too. Now the exercise version of it, like you may choose to do for a timed-based thing where you do a couple minutes, or you can do for an effort-based thing. Either way, nobody should have symptoms while they're doing it. If you did, you already started to cash out, you're starting to fall apart, or maybe you need a little bit more break.
Yeah, or maybe it's just not the right exercise for you. And there's tons of other things that we can do for disc degeneration. Getting an individualized program for you is always the best bet. So you can, reach out to us, do a discovery session, maybe do something virtually or in person, depending on where you are. And we'd be happy to help guide you into what exercises is right for you and your condition you're dealing with.
Yeah, I think the misconception is that a lot of times people feel like these are the exercises they should be doing because someone said they listed these things out on a PDF. And that's not really true. Exercises should be hand selected, just like when you go into your doctor's office and they say you have this one type of heart problem you should use this one type of medication. Exercises are the same thing. Stretches are the same thing. And while one can make you feel better, one can also make someone else feel worse. And we need to make sure that we curate which ones are best for you.
Absolutely. So go ahead.
So if you guys are looking for help, we have a description below which has all of our contact on it. We'd love to help you. We'll see you next time.